Hello, and welcome to today's webinar, Uncovering America's Best Kept Secret, Family Resource Centers and Family Resource Center Networks. That's provided by the National Family Support Network. My name is Andrew Russo, and I'm the co-founder and director of the National Family Support Network, and will be your presenter today. As we get started here, want to get a sense of who is here in the virtual room. So we'll launch a series of questions for you. The first one is based on this map that you see here on the screen, which has regions of the US. So if you can take a moment to identify which region you're in, and then we'll launch a poll that will ask you to let us know where you're joining us from. And we'll also have options for folks who may be joining us from outside the US. So we're going to launch that poll now and ask you to weigh in on where you're joining us from. All right, last seconds to vote there in the poll, letting us know where you're joining us from. Okay, let's take a look at the results. Okay, so we see that we have people joining us from across the countries, with the largest group being from the Northeast. And then we also have another big contingent from the South, and welcome people from the Midwest, from the West, and also Canada. So special welcome to our Canadian participant today. And now we'll launch another poll to get to know you a little bit more, asking what your affiliation is. So in the middle of your screen, you'll see this poll asking you to select which affiliation most closely relates to the organization, the entity you represent today. And if you happen to select other, please add into the chat what other represents so we can welcome you. All right, last seconds to vote in this poll here, letting us know your affiliation. Okay, and let's take a look at the results. Okay, so we see that we have a number of folks here who are connected with family resource centers. We also have people working with other family support programs, some people in education, also in child welfare, and other government departments. We also have a number of private funders here today, and also some folks who selected other. And again, if you selected other, feel free to add into the chat what other represents so that we can welcome you. Great, so we're glad to see you all here for this presentation on America's Best Kept Secret. And this is our agenda today. What we'll be covering, we'll be talking about family resource centers, and then we'll also be talking about networks of family resource centers. Then we'll go further up to talk about the national networking of these networks of family resource centers. And we'll share resources and opportunities available through the National Family Support Network that may be of use to you in your work. So that's our roadmap for our time together today. One thing I want to mention is you're welcome to share your comments, insights, aha moments as we go in the chat. And if you have questions, please add the questions to the Q&A box. So there are two different boxes. There's the chat box and there's the Q&A box. So if you have questions, please add them to the Q&A box. And if you have comments, aha moments, things to share, love to hear them, please put them in the chat box. Okay. So there are some handouts from today's webinar that will be put in the chat now, which are in a Dropbox folder. And the recording of today's webinar and all the handouts will be uploaded to the National Network website tomorrow. So by this time tomorrow, you can find the recording and the materials on the National Network website on the Webinar Wednesday page. And that's also where all our past webinars are archived as well, our Webinar Wednesday library. Okay, so let's go here. In terms of talking about family resource centers, the history of family resource centers goes back more than 100 years to the turn of the last century, when families were coming to this country in large numbers, primarily from Europe. And these settlement houses, like the one you see on the left, sprung up to help support those new immigrants to succeed with life in this new country. So these settlement houses in cities such as Boston, New York, Chicago, San Francisco provided different kinds of supports, such as English classes, job skills training, information about navigating the new society, and also opportunities for people to preserve their home cultures as well. So that image on the left comes from the Good Samaritan settlement house in San Francisco. And on the right, we see the exact same location today, which is now the Good Samaritan Family Resource Center. And this Good Samaritan Family Resource Center continues to work with a population that is primarily an immigrant population, with now the immigrants coming primarily from Latin America. And some of the supports and services they provide are exactly the same as more than 100 years ago. So English classes, job skills training, which now is computer or tech training, and also lots of programs that support the healthy development of children and families, as we know that's so important to helping folks to succeed. So the legacy, the history of family resource centers goes all the way back to the settlement house days. Family resource centers have emerged organically across the country. They may be community-based, like the image you see on the left, or they may be school-based, like the image you see on the right, which comes from Vermont. So Vermont on the left, Kentucky is on the right. And these family resource centers, having emerged organically, we often talk about them as America's best kept secret, because people who know about them love them, but most people don't know about them. And so that's the secret we're going to let you in on today, talking about FRCs. FRCs work with families with an approach that is multi-generational, strengths-based, and family-centered. So each of these concepts is critically important in terms of how we work with families in the first place. So multi-generational work, you may have heard of two-generational work or two-gen work. The idea of multi-generational work is you're focused on supporting the child, supporting the parent, and also supporting the grandparents that may be in the picture, or other caregivers or relatives as well. So looking at the whole family system. We're never just looking at the individual, we're looking at the larger family system. Our work is strengths-based, so we see families as coming to the table with strengths and resources that we want to support them to further develop and build upon. And family-centered. Everything we do is, of course, centered on the family. Family resource centers are designed for all families. So not just for low-income families or families who are facing a lot of challenges, but designed for all families. And this makes a big difference in terms of their services and supports being non-stigmatized. These are the kinds of supports that everyone could benefit from. The image you see on the right comes from New Jersey. New Jersey has 21 counties and 57 family success centers. That's what they call family resource centers there. And that includes counties that are very affluent, as well as counties that are highly challenged as well. So that reflects that perspective that the support for families should be universal, that all families should be able to access these kinds of supports in their communities, that all of us could use support with two of the most important roles we can have as adults: being parents, being spouses or partners. Two of the most important roles we can have that we typically receive nothing in the way of training or support for. So here are family resource centers to help us to succeed. They provide services and supports that are at no cost or low cost for participants, and they support families to build protective factors. So protective factors, the ones in particular we're going to focus on, come from the Center for the Study of Social Policy. So we're going to launch a poll question here to ask about your familiarity with these protective factors, just to get a sense of what our baseline here is. And if you're not familiar with them, no problem, we're going to be going over them. But just to get a sense here, you'll see a poll in the middle of your screen asking how familiar you may be already with the Strengthening Families protective factors. So if you could take just a moment to answer this poll. All right, last seconds to vote in the poll here. And let's see the results. Okay, so we've got a wide range here with folks who are familiar and also folks who are not familiar. So this will be a little bit of a review for some of you and also new information for others. So the Strengthening Families Protective Factors come from another national organization called the Center for the Study of Social Policy. And what they did in 2005 was research to find out, are there certain factors that, if families have them, are more likely to indicate that families are healthy and strong and less likely to experience child abuse and neglect? Could we identify factors that actually relate to that? And the good news is they were able to find that there were these 5 protective factors that are listed here, which include parental resilience, which is the ability to weather the storm of different challenges in life. Social connections, parents, caregivers being connected with other parents and caregivers. That decrease of social isolation, connecting with others, makes a big difference in terms of families being strengthened and supported. Concrete support in times of need. So access to basic resources like housing, food, these kinds of things that ensure that families have what they need to succeed. Knowledge of parenting and child development. So you've all heard the expression that children don't come with instruction manuals. So in terms of supporting families to succeed, helping families to understand their children's healthy development and what to expect and how to support them in that. And finally, social emotional competence of children, which has to do with supporting children to express themselves and connect well with others. You can find out lots more information about the protective factors via the CSSP website and the link that's there below. So in terms of thinking about them, this is the important framework to keep in mind as we're working with families. We want to be supporting them to build these 5 protective factors, since we know these make a difference. When families have these protective factors in place, again, they're more likely to be healthy and strong, less likely to experience child abuse and neglect. So family resource centers have no dedicated federal funding. So they're not like home visiting programs or after school programs or Head Start programs, all of which have dedicated federal funding and all of which generally people know about. So they're not like that. They have no dedicated federal funding. And yet there are more than 3,000 of them nationwide that work with more than 2 million people annually. Well, how could that be? How could that be that without dedicated federal funding, that so many different states and counties and cities and communities have chosen to invest in these centers when nobody is telling them that they have to? And the answer to that question is because FRCs, Family Resource Centers, are just a good idea. Family Resource Centers are cost effective. So they are not big budget items, and they are centers that give well more than the bang for their buck. And we'll see more about that as we look at data later in this presentation. Family resource centers are highly adaptable. So they are designed to look and feel like the communities they're working with. So FRCs exist that work with Native American communities, African American communities, urban communities, Latinx communities, rural communities, LGBTQ communities. FRCs look like so many different things because they work with different communities. So they're inherently flexible to reflect the rich diversity of our nation's families. So that's another reason why they're popular, is because they're flexible like that. And finally, FRCs have demonstrated successful outcomes through multiple external evaluations. So we'll share some of that data today to give you more of a sense. So these are the hallmarks of why we think FRCs have caught on as such an effective strategy, when, again, there's no reason why people should be investing in these centers unless they really believed in their value add. And this is what we've seen. Family resource centers bring together many different supports and services in one conveniently accessed hub. So supports and services that may be well familiar to you already, such as home visiting, parenting education, childcare resource and referral, family counseling, job skills training, bringing these services and supports together in a convenient location that families can readily access. It's important to understand too that family resource centers are of, by, and for the communities served. So when you may have heard about things such as human-centered design or community-based work, this is literally what this is, because FRCs start with planning their supports and services based on what the opportunities and needs and challenges are within a given community. So the image you see on the left comes from San Francisco with a community needs assessment taking place in a particular neighborhood, trying to hear directly from parents and caregivers about what are their concerns, what are their challenges, to then develop services and supports that will be reflective and responsive to what will be useful. Staff are also hired at the centers who represent the community served. So speaking the same language, sharing the same cultural background, that makes a big difference in terms of the authenticity and the ability of participants to relate to the staff at the center. And also family resource centers have parent advisory committees. So these are committees that guide and shape the work of the center on an ongoing basis. So FRCs are highly connected with the community and highly accountable to the community. So because of that, because they're so deeply rooted in the community, we often say, if you've seen one family resource center, you've seen one family resource center. Because again, working with such great diversity of families, and in this way, illustrated here, they're going to look like different kinds of things. And yet, at the same time, there is remarkable commonality across their core work. And this information on your screen is thanks to research that was conducted with the support of the Robert Wood Johnson Foundation in 2015-2016, researching those FRCs across the country. And it identified there are these four most common areas of work. So the first is parenting support. So parenting support exists along a continuum from lighter touch to more intensive services. So starting with parenting workshops. So workshops on healthy children's development, infant nutrition, things like that. So parenting workshops, one-time workshops, and then next we go into parenting support groups. So the ongoing support of caregivers coming together, sharing the joys and challenges of parenting. Further down the continuum is parent education series, typically using an evidence-based parenting curriculum. And then finally, home visiting representing the most intensive service of visiting with families in their homes to provide support. And for states that have family resource centers, in addition to home visiting, because all states have federally funded home visiting, for states that also have FRCs, it is very common to see FRCs and home visiting connected, which is logical for a number of reasons. First is that in terms of working with families in their homes and bringing support to them, that's wonderful. But we can't get to the protective factor of social connections unless we connect families with other families. And that's unlikely to happen in their home or little apartment or such. So having a center where they can physically come together, connect with other families, that goes a long way to building that protective factor. And the other advantage of leveraging home visiting programs and FRCs is that the worker working with a family isn't trying to figure out everything herself. She has the resources of a whole center behind her with different supports and services to offer. The next most common area of work is access to resources. So this also exists along a continuum from lighter touch to more intensive services. So starting with what we call enhanced information and referral. So that's making the warm handoffs and connections for families to different resources and supports offered by other organizations or entities. And it includes follow-up to make sure that they got what they needed. Next, concrete supports. So that's when the center is able to directly provide support families might need, such as food. Many FRCs have food banks or food pantries that they run, and clothing that they distribute, diapers, and infant formula, and rental assistance you could access in other FRCs. So concrete supports that help families, again, with that protective factor of concrete supports in times of need. Next, on the continuum is working with families over time to address family identified goals. So in the past, this used to be called case management. We don't call it that anymore because we don't see families as cases to be managed, called family development work. So supporting families to, over time, address their goals that they want to get to. And finally, co-location of resources. So that's when external resources are co-located at the center, again, that welcoming, accessible, non-stigmatized hub to make it easier for families to access them. So for example, in Tennessee, there are government workers who are outstationed at FRCs to help screen families for benefits, sign them up for programs that they may be eligible for, which again makes it much easier for families to be able to access them right in their community versus trying to go downtown with little kids, 3 different buses to get to a place that doesn't even have a waiting area that's suitable for your children to be in while you're meeting with your worker. FRC just changes that all up, bringing the supports and services, the access point into the community. Child development activities. So those are activities that are focused on supporting children's healthy development. And finally, parent leadership development, such as work with parent advisory committees, as we talked about before. So across the country, these are the 4 most common areas of work of FRCs. And the 2 most common are those at the top, parenting support and access to resources. So we talk about those as the bread and butter of any FRC. That's important to keep in mind with some information I'm going to share with you in a little bit. All right, so it's also important to understand that family resource centers are not just a list of services. So they're not just all these services coming together, which is good and wonderful in itself. Family resource centers also create communities, and that's an important hallmark of their success as well, is they connect families to other families, as you see in these images from Massachusetts and New Hampshire, where parents connect with each other, build relationships, and are part of a community of parents and caregivers providing peer support for each other. We know this goes a long way to supporting families and families feeling that they're not alone, that there are others out there, to have relationships and friends who can help out with pitching in for childcare or sharing information about where to find a good pediatric dentist and things like that. And again, as mentioned before, we know that social isolation is highly correlated with the likelihood of child abuse. So breaking down those barriers where families connect with each other, this goes a long way to supporting families to be healthy and strong. All right, so you've heard me say a lot of things about FRCs. We're going to turn to hearing a parent's perspective here now. This is Sheila Harwood, who has participated in the FRC in upstate New York, in a rural community where she lives. So let's hear her perspective on FRCs from her experience.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles, and it's the same every single time they walk in the door. The staff is so friendly, the place is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax. And it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life, regardless of anyone's socioeconomic status, regardless of racial background, educational level. The need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
Great. Right. So now that we've talked about family resource centers a bit, we have a poll question for you, our last one for today, which is whether you've seen programs that look like family resource centers in your states so far. So now that you understand what they are, these welcoming hubs of support for families that provide parenting support and access to resources again, the bread and butter. They may provide lots of other things, but definitely they provide those as FRCs, and that there are no income requirements and all families can come and are welcome, which is a big difference from Head Start programs or other programs that have very specific requirements for who can participate. So the poll question in the Center to Your Knowledge, does your state have programs that look like FRCs? And for a Canadian participant, that would be province instead of state. And let's see what the results are. All right, so for those of you who weighed in here, we see that the great majority of you indicate your states do have FRCs, which is great to hear that this is already happening in your communities. And then a number of you are not sure, which is also understandable, because once again, this is a secret. It's something that's typically under the radar, which most people don't know about. All right, so thank you for weighing in on that. So I'm going to talk about FRCs in relation to the recent pandemic. So through the pandemic, everyone has been challenged and families were particularly challenged. And two of the things that families were most asking for support for were parenting support, in particular, parenting stress support and access to resources. And as I mentioned earlier, every single FRC provides exactly that as their bread and butter supports, parenting support and access to resources, whether they're big, small, urban, rural, school-based, community-based, they all provide those two things, which turned out was exactly what families were asking for most. So FRCs rolled up their sleeves, answered the call, redoubled, retripled, quadrupled their efforts to do anything and everything to support families through the pandemic. So what we saw was things like these images come from Kentucky, where in Kentucky, the FRCs are school-based. The schools were closed, but the FRCs stayed open. The FRCs stayed open throughout the pandemic and did things such as you see here, going out to visit the families and let them know that they were still there to support them and help them out. They also ensured that the free lunches were delivered to children because they couldn't get them at the school. So the FRC went out and brought them to them. On the right, you see an image from Colorado, where Colorado received $3 million in infant formula from FEMA, which is great. But how do you get that out into the hands of families? Colorado has a strong network of more than 30 FRCs. They sent it out to the FRCs got that right in the hands of families. You also see images here from Massachusetts, Martha's Vineyard, where they switched to virtual programming, where Storytime now became virtual. And this is a bilingual one in English and Portuguese. So FRCs really answered the call through the pandemic. And what is very interesting is what happened next. So in May of 2020, Alabama was the first state that increased their support for FRCs. So they had already had FRCs and had them for quite some time, about 20 years, but they moved FRCs to be a line item in the state budget for the first time and increased their resources, recognizing that FRCs had really shown their value, and FRCs are not just valuable in times of crisis, but they're always good to have around. So Alabama was the first state, and then they were rapidly followed by states red and blue across the country. You see here California, Colorado, Hawaii, all of which started to commit more resources to FRCs, having seen how FRCs responded so well to the pandemic and saying, yes, this is something we really want to resource and support. So there's not just one slide about this. There are 4 slides about this: Kentucky, Maryland, Nevada, New York, Texas, Utah, Vermont, Washington. There are so many states that keep investing in FRCs, West Virginia, Wisconsin. We can't even keep this slide up to date. There are recent investments from Georgia and Kansas that haven't even made it to this slide yet. So this is an amazing time. We've never seen anything like this from, again, something that's been so under the radar, where suddenly it's getting attention, where suddenly states are, and municipalities, New York City is there as well, are recognizing the value of FRCs and further investing in them. So it's very exciting to see the secrets start to get out. So also want to take a little time to talk about FRCs in relation to child welfare. For those who may work with the child welfare system, I know we saw several folks here today from the poll. So this is a diagram that was developed in conjunction with Casey Family Programs, which is one of our funders, looking at how FRCs work with families in relation to the child welfare system. And this is one of the handouts that's available to you in the Dropbox there. And what it does is show the continuum, starting with primary prevention, which is what FRCs are most known for in terms of supporting families to build those 5 protective factors to be healthy and strong, to never enter the child welfare system in the first place. So that's what FRCs are most known for doing, that primary prevention work. But FRCs also work with families across the continuum of potential child welfare involvement. So the next part of the continuum here is differential response. So differential response, sometimes known as alternative response, is when a call comes into the hotline, child welfare, and the caseworker determines that it doesn't reach the level where they're going to open a case, but they could tell there's some issues there, the families could use some support, so they refer them to the FRC. So they refer them to FRC on a voluntary basis. And we'll talk about more what we've seen in data and research from what happens when they do that. Next is when there is an open child welfare case. So when there is a case, then the Family Resource Center is there to support the family. So let's say the family is referred for mandated parenting education. Okay, well, where do you send the family for mandated parenting education? For states, municipalities, jurisdictions that have FRCs, you send them to the FRC, because the FRC is already providing parenting education, already using evidence-based curriculum there. And the beauty of leveraging the FRCs for that is, again, the FRCs are non-stigmatized. They're for all families. So when the families go there for parenting education, they're there in the classes with parents who are there voluntarily. And unless they self-disclose, nobody can tell the difference who's there voluntarily versus who's mandated to be there. So it reduces the stigma around accessing these supports, and then also connects families with other supports and resources. Since an FRC doesn't just provide parenting education, they have all these other things going on. And again, that building of a community of peer support is part of the mix as well. And FRC staff work in partnership in terms of just blanked to the word, in terms of working in complementary ways with the child welfare staff. So the child welfare staff can do A and B for the family, and the FRC is working on C and D for the family. So work together in complementary ways and coordinate in what's called team decision-making as well. And FRCs also have been leveraged to be sites for supervised visitation. So when the child is removed from the family and then you have a visitation opportunity, or family time as it's now being called, the FRCs are leveraged to host those visitations, such as in San Francisco, which again provides that in a welcoming hub in the community, as opposed to some, very inaccessible location that no family wants to have anything to do with. And then finally, post-reunification. So when families and children are reconnected, there may still be issues there. And so who's there to provide ongoing support or wraparound support afterwards? The FRCs. The FRCs are still there, able to connect and support families on an ongoing basis beyond the closing of a child welfare case. All right, so that illustrates the continuum there. And then I'm going to share some data points with you, as I mentioned, starting with this one, which comes from Alabama. So Alabama commissioned a return on investment study, a social return on investment study. And what they found is that for every dollar invested in FRCs, that there was a $4.93 return in terms of immediate and long-term consequential financial benefits. So basically a 1-to-5 ratio for their investment in FRCs. In Allegheny County, which is in Pennsylvania, where Pittsburgh is located, they worked with the University of Chicago Chapin Hall to research their 28 family support centers. That's what they call FRCs there. So there are 28 of them just within one county. And they looked at those centers in relation to matched neighborhoods that didn't have centers. And what they found is neighborhoods with centers had a statistically significant lower rate of child abuse and neglect investigations. So 26% lower rate than neighborhoods without them, which just makes sense, because if we're supporting families to be healthy and strong up front, the less likely they are to show up in the system later. This is my favorite data point of a number that we'll share with you, which comes from Teller County, Colorado. So it's a semi-rural county outside of Colorado Springs. And in 2016, their Human Services Agency and their little county moved to a differential response system, which we talked about earlier. So as the calls came into the hotline and they determined they weren't going to open a case, they referred the families to the Family Resource Center. All voluntary, they gave the information if the family wanted to access the center. And what they found from doing that is since 2016, that there has been a 63% reduction in the child abuse rate. 63% reduction. And that county only has one FRC. So think about that. Just by referring families on a voluntary basis to the one FRC in the whole county, they've more than halved the number of children in the system. Think of the cost savings in that, not only in terms of the money that's saved, but in terms of the human costs that are saved. All those children and families who will now not enter a system that no family wants to have anything to do with. And once you're part of, you may never get out of. Clearly demonstrating that FRCs are an incredible resource to the communities that they're in. We took that data further with the support of Casey Family Programs with 2 research reports that looked at putting dollars and cents to that statistic that I just shared from Teller County, and also comparing that data with an urban FRC in Orange County, California. So looking at 2 different jurisdictions and the impact of the FRCs, and determined that, as you can see here, excuse me, significant savings to the child welfare system from the FRCs, again, supporting families to be healthy and strong up front and not end up in the child welfare system, which of course is a very expensive system, as well as the human costs of the system that we talked about earlier. All right, so in Colorado, they also did research on the families who participated in the centers across the state and found that there were statistically significant improvements in a number of positive domains that support families' healthy development, including economic self-sufficiency, health, social support, and as well as caregiver nurturing and attachment. And this statistic data comes from Kentucky. So Kentucky is a really interesting story with FRCs, where about 30 years ago there was Kentucky was doing really poorly in terms of its education system. It was actually a big lawsuit and then a legislative effort to reform the schools. And part of that education reform measure was creating the opportunity for schools to have FRCs. So someone at the table thought about and recognized that if they were trying to improve the schools, thinking about how families were engaged with them could be part of helping their success. So they created a formula that for any school that had 20% free or reduced lunch children, they could have an FRC if they wanted one. They put that out there. They had no idea how many principals, how many school districts would actually be interested in having an FRC. And it turns out everyone was interested in having an FRC, which is why 30 plus years later, there are 887 school-based FRCs in Kentucky. It is the second largest system in the country, second only to California, which has about 1,000 FRCs. And during that time, Kentucky has moved from doing really poorly to being among the top 15 school systems in the country. So there's been dramatic improvement. And there are a host of factors that have supported that, of course, but we also know from research that when families are engaged, children and schools do better. And FRCs that are school-based are not only focused on supporting the families of the children in the schools, but they're also focused on supporting families and children who are not school age yet, with a big focus on school readiness, which of course is key to academic and school success as well. So that's the Kentucky story. So now turning a bit to nuts and bolts, what does it cost to run an FRC? I mentioned these are cost-effective programs. These are not big ticket items. And it's hard to talk about the costs because they vary so much. It relates to the population you're working with, the area of the county, whether the country, whether you're school-based and have your space leverage through the schools, or whether you have a center that you needed to build an outfit and such in the community. So there's great variation, but we share with you here 2 data points, one from New Jersey, which has community-based FRCs, and one from Kentucky, again, with school-based FRCs. So you can get a sense of what the budget of those FRCs are to give you a sense. So how are FRCs funded? So across the country, what we would see is mostly government funding through state or county or municipal government. So most of their funding would be government sources from states, counties, cities that have recognized the value of this work and chosen to invest in it. There are some federal dollars in the system as well, not dedicated federal dollars, but for example, there is flexible funding to address child abuse prevention that comes from the federal government. And for many years, it was a very small amount of money, relatively speaking. It was $40 million or so, which is less than $1 million per state. And states could use this money for pretty much anything and everything related to child abuse prevention. And many states chose to use it to invest in FRCs, recognizing FRCs are not big ticket items and they produce great results. So if they're trying to leverage that funding to go as far as it could for the children in their states, this was something worth considering. You would also see foundations, corporations, individual donations, and in-kind support leveraged by these centers. Also want to talk for a minute about FRCs in relation to Family First. So the Family First Prevention Services Act is a big piece of child welfare legislation that went through several years back now, about 5 years back. And this was designed to support families and children to stay together as opposed to separating them when there are child welfare issues. And one of the provisions of Family First is that community-based organizations can be leveraged to provide parenting skills-based programs. And the FRCs are a logical resource to leverage for that because, as mentioned earlier, they're already providing parenting education and they're already using evidence-based curricula, which happen to be on the clearinghouse that's referenced here that the programs need to qualify for to be eligible for the federal funding. So this is a great opportunity for states that have FRCs or are thinking about developing FRCs to plan for how they might leverage that federal funding to now support the kind of work that FRCs are already doing. And the way the provision is written, it talks about in-home parenting support. And some people sometimes confuse that with thinking that the services have to be provided in the home, like home visiting. And home visiting is a good example of what it could be used for, but it doesn't mean that. In-home means that the child and caregivers are still together, that they're in the home together. So that's what in-home means, which is why the services can be provided in community-based settings. All right, so another part of Family First has to do with kinship, caregiver support. So those are maybe grandparents, aunts, uncles, other relatives who step in to support families when parents are unable to. And this is another area where FRCs can provide support and be leveraged. And New Hampshire was the first state to do this, which just makes sense because in terms of kinship support, helping these folks who are now caring for children to be able to navigate systems and access benefits and such, that's exactly what FRCs do anyway. So connecting families up with FRCs in New Hampshire was what that state decided to do in terms of leveraging existing resource to, again, support Family First implementation. Okay, so now that we've talked about FRCs, we're going to go one level up and talk about networks of FRCs. So how networks come together. So first of all, the definition of a network that we use is two or more FRCs coming together. So two or more FRCs coming together, and they may come together in different ways. They may, the directors of the centers may connect with each other. It may be a funder that brings them together. It may be an organization that plays a key role in working on children and family issues, a policy organization that brings the programs together. They can happen in different ways, but that's our definition, is two or more FRCs. So for those of you who said you have FRCs in your states, if you've got at least two of them, you have the makings of a network. And what we have seen is states have not only invested in FRCs, but they also independently hit upon the value of networking them together, recognizing when they network the centers together, you can leverage them more, that there are more things that FRCs can do, not just individually, but as a system of support, a coordinated system of support. And the FRCs serve as the backbone for the collective impact of the FRCs, for those of you who may be familiar with collective impact or collective impact language. The most common functions of these networks also come to us from research in 2015, 2016 that was supported by the Robert Wood Johnson Foundation. And surprise, surprise, FRC networks come in lots of different shapes and sizes too. But once again, there's remarkable commonality across their four most common areas of work, which are increasing connectedness, coordination, cooperation, and collaboration amongst members. So all those good C words. Next is providing technical assistance and training. So once you bring all the folks together, getting everyone trained up on the same page about working with families in quality ways, for example. Working on policy, advocacy, systems change, recognizing that together they can impact change for families far more than an individual FRC working on their own. And finally, maintaining and providing a shared data tracking system is a function that we see a number of networks provide. So that, again, everyone can be on the same page about collecting data, being able to compare apples to apples across a state and tell the story of the impact of their valuable work. We talk about FRC networks in some different characterizations here. The first at the top is stages of network development. So we talk about networks that are emerging in the early stages, 0 to 3 years, just getting going. We talk about evolving networks that are around for 3 to 5 years, by which point they typically might have staffing and a record of things that they've done together and more structure. And then finally, established networks. And characteristics of established networks include a track record of different achievements. And interestingly enough, they've weathered challenges together and chosen to stick together at the end of the day. And established networks typically have staffing and more resources. We also characterize networks in terms of how they're coordinated. So they may be volunteer coordinated, is when we refer to them when the center directors are coming together and coordinating the networks on top of their jobs running the centers, and there's no paid staff. Another example is funder coordinated networks. So that may be a public foundation or a private, a public department or private foundation that is not only funding the centers, but is supporting them to come together and focus on those network functions that we talked about on the earlier slide. And finally, an independent nonprofit. And that's when the network functions like a membership association, as the networks do in places like Wisconsin and Colorado. They collect dues from their members and provides supports and services for them. And they may be intermediary, where they raise money and give it out to their members, or they may be non-intermediary, where they don't do that. So those are some of the ways we characterize and talk about FRCs, which, as you can see, there's distinctions here. All right, so now we're going to go up one level further. So we talked about FRCs, FRC networks. Now we're going to the national picture. And this is where the National Family Support Network comes in. So in 2011, this is what the map looked like when we were first getting started. When California, which had a network of FRCs that was founded just 2 years before this, in 2009, California reached out to find out, were there other states that not only had FRCs, but had networked them together? We found out indeed there were, and we all met together in Colorado in 2011 and co-founded the national network. So this was also volunteer coordinated. So on top of our full-time jobs running state networks, we pitched in our sweat equity to run the national network for the first 4 years. And then once we had resources and staffing in 2015, the map began to change. And this is what the map looks like today. So in the past 11 years, the national network has more than quadrupled in size to now represent 37 member networks. That's 36 states and the District of Columbia that serve more than 3,000, that represent more than 3,000 FRCs that serve more than 2 million people annually. So we've seen this dramatic growth. And as you can see, East and West and red and blue states all coming together with networks of FRCs. So not just FRCs, but actually developing networks of them, which is amazing to see. And that's not because suddenly there was all this federal funding that states were pulling down. It's as more states came to presentations like this, learned more about FRCs and started asking, hey, why aren't we doing this for families in our states, versus the other states that have these programs already? Like, we should be doing this too. These are good things to have. And that's where we've seen this dramatic growth. Now, if you're joining us from any of the states that are white on this map, it doesn't mean they don't have FRCs, because there are FRCs in a number of these states that are not yet green on this map, such as in Montana, there are FRCs. In Wyoming, there are some FRCs. In Oregon, there are definitely FRCs, but no one has networked them yet. And that's the key to membership in the national network, is that there's a network in a state. The mission of the national network is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of those state networks of FRCs and championing quality family support and strengthening practices and policies. And our vision, simply put, is that that whole map would be green, that all families would be able to access quality supports and services in their communities through FRCs that are supported by strong networks. So we wouldn't think twice about there being an FRC in our neighborhood, just like there should be a good school and a park and a library. These are just building blocks of a healthy community. So if you happen to be joining us from a state that's not yet colored in green, we're especially interested to connect with you. The areas of work of the national network are, first and foremost, connecting those networks to learn from each other. So peer share, connect with each other. They really appreciate that, because then they don't have to reinvent the wheel. They can see how other people have done things and support each other. Next is promoting family support best practice and evaluation. And that's where our work comes in with the nationally adopted standards that I'll talk about in just a little bit. And finally, number 3 is raising the visibility of the value of impact and the value and impact of FRCs, what we're doing today. That's core to our work, continuing to share the good news about this secret. To join as a state network, the criteria is that you have 2 FRCs at least, and they're coming together. We also will welcome in states that are just about to develop FRCs as well. And they may be at any stage of development. And there's also only 1 member per state. So we only admit 1 member per state, with the thinking, again, it's all about coordinating, all about bringing all the players together at the table. And the dues, as you'll see here on the slide, are intentionally modest. So basically the highest level of dues here is $100 a month. And that's because this is not a money-making enterprise. This is designed to ensure that all states will be able to have a seat at the table and will be able to coordinate this effective work together. And those dues cover the whole state, regardless of the number of members that they have. So whether you've got 10 FRCs or you've got 887 FRCs, you all pay the same dues. All right, so I mentioned standards, and now here I'll talk a little bit more about these. So in this field, in this landscape, with all these different programs having emerged organically, all these different networks having emerged organically, doing this wonderful work, it's all great, but how do we bring it all on the same page? And this is where the development of standards is a really important key piece in the history and development of our field. So the nationally adopted standards of quality for family strengthening support are designed to be used by everybody in the field. So foundations, public departments, community-based programs, and families themselves as a tool for planning, providing, and assessing quality practice. And they bring together two important frameworks in the field. One is the principles of family support practice, which come from another national organization, originally Family Support America, called the 9 Principles of Family Support. They show us how to work with families in quality ways based on those principles to help families to build those 5 protective factors that we talked earlier. So they bring those two frameworks together, again, because as long as we're going to be working with families, we want to be doing it in quality ways and want to be supporting them to build those 5 protective factors that we know actually make a difference. So the standards show us not only how to do that, but how to measure how well we're doing that. They create common language and expectations across different types of family support programs. So they're used by FRCs, but actually they're designed to be used by any program working with families. So whether you're working in a home visiting program or working with families in the schools or in an early care and education program, we would say that you would find your work enhanced by learning about focusing on using the standards. And the standards and all the implementation tools are available for free on the National Network website. So we're not selling the standards. We want everyone to have access to and think about quality work with families. The standards were revised last year, where we worked with a diverse group of stakeholders across the US and Canada and parent leaders, and together revised those standards that they would be relevant for both the US and Canadian contexts, and reflect an enhanced focus on diversity, equity, inclusion, which is both one of the 5 sections of the standards and also infused throughout the standards. That the other core areas include family centeredness, family strengthening, community strengthening, and evaluation. Oops. Okay, all right. And this map shows you where the standards certification training has taken place, which sometimes that means it's virtually taken place there, given where we are in this point in time. But whether it's happened in person or it's happened virtually, these are the states that have hosted or held standard certification trainings, which is another piece of the standards work, is that there's a training that goes along with that. And the National Network offers this training, and we also support our members to develop their capacity to offer the training for their states. So that's one of the unique benefits of membership, is that those state networks then have the opportunity to develop trainers and be the place to go to, the go-to place for the training in their states. And what you see is where the training has taken place, and that there are more than 13,450 people who've successfully completed the training, which is just amazing. I also see in the chart the states that have developed trainers and how many people have been trained in their all states. And this is going a long way to build that common language and get us all on the same page about quality work with families and how we plan for, assess, and assess it. Okay, so another piece to mention is the kind of work the National Network focuses on in terms of policy. And this is the newly released blueprint for the development of strong networks of FRCs that the network issued in May of this year. And it focuses on 4 key areas that we want to support, both through work we can do and connecting with other stakeholders, federal government, et cetera, to move forward. So that includes strengthening existing FRC networks, establishing new FRC networks. So we don't go into a state and set up a network. We work with stakeholders there to help support them to do it. So that's a key piece of this. We also want to strengthen the workforce in our field. And one of the new things that we're looking at are actually wages and compensation, which is not an area that has really been focused on in our field previously, unlike other fields such as early care and education that have long held attention to that and been successful in in their work. It's something new for us to actually talk about, wait, what are we actually paying our staff? And how can we collectively try to raise the bar about that? And finally, connecting and leveraging FRCs with other initiatives, recognizing that FRCs are there in the community already doing this wonderful work. How can they help with different other initiatives and things to roll out, such as vaccine education, for example, has been a big one. Trying to get out accurate information to families. Well, how do we get it out to families? Leverage the FRCs. They already have those trusting relationships with families where they can be the conduit to accurate, helpful, useful information for families. This is one example of how FRCs might be leveraged to support other efforts. Okay, and these are the partners that the National Network works with, some of which we work with from the very beginning, 11 plus years ago when we had the idea of starting a network, and we went to talk with the federal government and other stakeholders here about the idea and how we might work together on it. And it has developed over time. So includes Casey Family Programs, the Center for the Study of Social Policy, the National Membership Organization for Children's Trust Fund, our peer network to the north, Families Canada, and other organizations as well. So these are our partners. And now we've come to questions, answers that you might be interested in. If you can type your questions into the Q&A box. So the Q&A box, we'd love to hear what's on your mind, what you'd like to explore more or ask about. And if there's also something that you want to share, something that resonated with you, a highlight, a comment, put that in the chat box. So we also welcome you to share your thoughts in the chat box here to let us know how this information is resonating with you. All right, so I see a question in the box here is how many staff does a typical FRC have? So this varies widely, and the single biggest expense of an FRC, like any nonprofit, would be its staff, right? Because this is all about people and people working with people, where this is all relational work. So you would see FRCs that just have one staff person. In Kentucky, a number of those FRCs have a single staff person or 1.5 people, maybe 2 people. They also leverage a lot of volunteers and church groups and others to help. And then you would see FRCs that have, several dozen staff that work on lots of different things supporting communities. So there's a great variation in terms of the number of staff positions you might have at an FRC, but you at least need one person, right? And whatever she or he can't do themselves, they could make referrals for. The last FRC I directed, we had a team of 4. So there were 4 of us, a director, associate manager, a family support worker, and also our administrative manager. So that's just an example. Right, other questions people may have. So I see a question about what kind of data tracking systems that FRCs use. So again, this has emerged organically, this work, so it's going to vary a lot from state to state. And some states have very highly developed systems for tracking data, like San Francisco is a county that does. Colorado as a state has a really great system, and that's one of the reasons we're able to show you great data, because they have a really good system that it starts with assessing how families are coming into the program and then tracking their progress over time, and then being able to show the outcomes later, for example. So there are different systems that are used across the country. One of the good things about the Colorado system is that it's actually available for other states to use. So they share that with other states or jurisdictions that want to use it for a very, very low fee. So we always encourage folks to look at what Colorado is using, since it works and is available at a very low cost. All right, so let me point to some other resources here. Well, you may still be thinking about questions to keep adding into the chat, or excuse me, questions to add into the Q&A box, or comments to add into the chat. Let me just go over some other resources here to walk you through in the meantime. One is that we have some upcoming webinar Wednesdays, like the one you're participating in today, which we offer several Wednesdays a month. The next one coming up on October 26th is an opportunity to dive into the Maryland Family Network. So if you'd like to hear the story of a particular network and what they're up to, you can come hear about what Maryland is doing, which is a really interesting story because they've been around for quite some time, but have also started changing up how they do their work. So it's a really interesting story with a particular focus on equity. And in November 2nd, we will have an overview of the standards. So if you're interested in finding out more about the standards, you can come to that as well. You can register from the National Network website homepage, and the webinars are free, everyone's favorite price. The webinar about the standards is not the same as the certification training, which I'll talk about in just a moment. Okay, so here it is, the certification training. I mentioned the National Network offers that training on the standards on a regular basis, and also our member networks do. So you can go to the website and look at up your state, if your state has a network and whether they're offering the training, and you can also access it through the National Network. And here are our upcoming trainings in October and November. Again, the registration is on the homepage of the National Network website. We also have another training, which is specifically around supporting the development of parent advisory committees. So I mentioned how important these are in terms of shaping, overseeing, supporting the ongoing development and accountability of programs to the community. What we developed as the National Network is a training specifically to support staff with how to partner with parents with this particular structure in parent leadership development, the parent advisory committee. So a lot of trainings out there to support parents in terms of developing leadership skills. This is a unique training that supports staff in terms of how we as staff step back and support parents to step forward in leadership, and how we partner in the decision-making in our program. So this is a unique training that's also offered regularly, with the next one's coming up this month and in December. And then we are also co-hosting this really big virtual conference that happens every 2 years called Together for Families, that we co-host together with the Families Canada and also the Center for the Study of Social Policy. And this is a really amazing virtual conference, so it's easy to access. You can just access it from your device. Everything is presented live, more than 40 sessions and interesting plenaries as well on top of that, and opportunities to network, very intentional opportunities to connect with each other. And it's for everybody. So whether you're working at the program level or the management level, systems level, there's something for everyone at this conference. And there are very, very few number of seats remaining because it's next week at this point. And you can find out more on its website, which is unique, the togetherforfamilies.org website. So that's coming up, and that's only every 2 years. So this is the last time you'll see that until 2024. Okay, in terms of other resources the National Network has, want to flag for you on our website, it is chock full of resources about FRCs and FRC networks. So that includes research reports that I went over today. You know, I shared the data points. You can pull the whole report and read it all, dive deeper. There are overviews about FRCs. The image on the right is a state profile. So you can download, look at our map, and then click on a state and download their state profile, which shows at a glance how many FRCs they have, what's their network up to, any outcomes that they've achieved. So we issue these annually, so an annual snapshot of networks in the different states. And you can also access and download the standards and all the implementation tools for free, as mentioned as well. And today I'm going to show you something new that we're really excited about, which is the FRC Network Hub. So recognizing that there are tools that can be useful to people as they're developing networks of FRCs and wanting to support people to not have to reinvent the wheel. What we created was this hub that has resources that relate to the development of FRC networks. And all this information is available for free on the National Network website. And I'm going to show you where it is. And you just register and then you can download and look at samples that developed by the National Network, templates, as well as samples from other states. So let me show you where this is. If you go to our website, National Family Support Network, and then you go to Family Support, this is where you can drop down and learn about family resource centers. All the information I mentioned, the data and all is there. And then you go to the FRC networks page here. And the FRC networks page includes all this information, again, data research, videos, lots of information about developing networks. And here's what's new. This is the Family Resource Center Network Hub, where you click on this link and it asks you for some basic information that then you register to access these different tools and templates that could help you with developing a network in your area, which we're also always happy to connect with you and talk about. So that's our newest resource that you're hearing about. You're the first group to hear about that. These are other supports and services the National Network provides, such as connecting folks with our members, also making presentations like this. We're happy to do that in your areas, and we do that for free. So if today got you thinking and sparked something, and you thought, this is something such and such should hear about in my state, like the Children's Trust Fund or child welfare leaders or others, call on us. We are happy to make presentations like this and dialogue with folks about exploring FRCs and the development of FRC networks in your areas. We also provide technical assistance for the development of FRC networks and the trainings I referenced earlier. All right, so here's contact information, both for myself and also for Julie Matusik, who's our senior manager overseeing the standards work, if you have questions or things related to that. Again, this PowerPoint that has this contact information will be up on the National Network website tomorrow afternoon by this time. And you also have the handouts in the chat, the Dropbox that you can access that includes the different information and as well. So last thing we have for you is an evaluation. So we'd really appreciate if we could just take a few minutes to answer a few questions that you'll see in the evaluation for this session. And it asks you both what you thought about this and what next steps you might be considering, so that we can see if there are ways that we can support and connect with you further. So with that said, I'm very grateful for your participation today and look forward to connecting with you further. Thank you for exploring America's best kept secret family resource centers and family resource center networks today with us.